Welcome to the new inpatient building at Beth Israel Deaconess Medical Center. Today, I would like to give you an inside look at one of our patient floors. Patient floors in this new facility will reflect BIDMC's commitment to providing holistic, patient-centered care.
There are 30 new private ICU beds, 128 private med-surg beds, and each one of them is set up as a unit where the clinician, the patient, and the family will be engaged in the continuum of care.
What's really exciting about the new building is that we're going to go from an 8-bed cardiac critical care unit that's nearly always at capacity to a 15-bed unit that will allow us to reach more patients. Having a much larger footprint means that we can expand the reach of our very high-quality services to patients who we haven't been able to reach.
My overall impression of this project is that thank you for doing this now at this time. It's so needed. It's going to be good for the patient because the patient's going to have some room, and as sick as they are, to be able to look out that window, that large window, and to be able to see something other than a brick wall. That's really important, and it's going to help them.
It's wonderful to see the family rooms in the areas where families can convene, both in the patient's room and outside of the patient's room. So when I look around here and I see the opportunity for family members to sleep over, to have conversations with doctors, to refresh themselves, that is a sea change.
We had a balance between what our patients and families were experiencing and making sure that we took care of our staff in a way that they were also provided for and cared for.
They have nice locker rooms, they have bathrooms and showers. We have a lactation room on every floor, really nice conference space for them, break rooms. It's just a really nice, open, beautiful space to work.
We really thought about the teaching mission that we have. We made provisions so that when our residents are rounding, that they had training space, they had space that was convenient to be able to visit with the patients, but also caucus about what they learned.
Having these conference rooms in a new building where we can all come together to learn together, to problem solve together, that's only going to improve the care of our patients even more.
So this is the nurses station area for one of our 15-bed ICU floors. To my left will be a quite large nurses station that sort of wraps around all of the 15 rooms, sort of the core of the unit. I feel like it really brings the clinicians to the point of care so that they're close to patients. You know, you can be at this charting station, you have your PC, phone, and you have your viewing window, which you can see into both patient rooms and see both of your patients.
This is a really nice way to be able to always have eyes on our patients, have eyes on their ventilators, their drips, their dialysis machine. Being able to be in a position where you can see both patients at the same time and be able to document and look up labs is really important.
Really wanted it to be quiet and peaceful, and then the back of the house is staff only, so that's where all our distributions and supplies and equipment, it all comes out of the service elevators. So you're not bothering the patients. There's no traffic coming through here that's unnecessary.
In some ways, it takes a page from hospitality, where the front of house is beautiful and soft and outward facing, and then you pass through a door and it's the service areas where the patient care is assembled and people and materials move through the building.
It will give you a sense of neatness and everything is in place, and that says a lot of what kind of care we provide.
So I think for nurses and doctors, you're proud to provide care in here.
It means that we'll be able to provide efficient, high-quality care in a space that's inspiring and joyful.
Now that you've had the chance to see what will soon be a patient floor, I hope you will consider joining us in supporting this incredible building and naming a floor. Thank you.